So what exactly is Cool Dash? It's an intuitive interface that allows you to quickly interrogate the entire Cancer Alliance Queensland dataset. This allows multidisciplinary teams to see in almost real time how they are performing, allowing them to make better informed decisions. The Dash uses a secure web-based ecosystem developed by Cancer Alliance that is accessible anywhere, anytime, and updated daily. As expected, Cool is password protected with ironclad server security, and clinicians can only access their own team's data. This is the landing page after logging in. Apologies, it does look a little bit busy, but I'll walk us through it. The Dash gives you clinical and demographic data about your patients at your fingertips and is a single unified platform with pioneering analytics. Dash is supported by the largest cancer data repository in the country with over 200,000 patients, 60 sources and 500 million records. In other words, Dash helps you to unlock the value of the data usually locked behind data silos, and it has excellent functionality. Let's now take a closer look. Once logged in, it's easy to quickly filter for specific types of patients at your hospital or health service. At our site, we use the activity trend to track patient numbers and compare over time and from year to year. This is a lung MDT, but you can quickly and easily drill down to see what primary cancer the patients who are being discussed actually have. For example, in this situation, how many patients with metastatic colorectal cancer have had their pulmonary nodules discussed? There are basic and quick statistics on the right-hand side which give you a quick bird's eye view of your specific MDT. You can also see the rates of representation needed, which can be a surrogate for how efficient your MDT is functioning, being able to have all the available diagnostic tests ahead of the meeting to avoid the need for repeated discussions. This graph tracks data quality to see what percentage of patients have had the minimum dataset completed. Again, how efficient is your MDT at recording all of the critical information? You can see that in this MDT, we need to focus perhaps a little bit more on ensuring that we have consensus TNM staging at the meeting. You might ask, why is this so important? Well, having all the information on a unified platform across the state facilitates seamless patient transfer. For example, if your center does not have cardiothoracic surgery, when referring your patients to another center for resection, that facility or any surgeon can instantly have access to all the patient information, saving time rather than chasing individual laboratory results, radiology, and histology. Here we see an overview of baseline demographics including age, comorbidities, TNM staging, ECOG performance status, socioeconomic status, indigenous status, and residential area, which are all available instantly. On the left-hand side, you can easily access and even export patient data with pre-filled data fields directly populated from Cool. Now, how cool is that? Let's now go through some statewide lung quality indicators. These indices were developed by Queensland's Safety and Quality Committees, and they allow you to review in real time the data from your MDT and compare with the statewide average for Queensland. Here you can see that this MDT is performing relatively well compared to the Queensland average in terms of post-surgical mortality. Survival is also better here than the Queensland average. However, time from diagnosis to surgery, on the other hand, is comparable, bearing in mind that this centre has to send patients to a metropolitan facility. On the right-hand side is the MDT overview, and here at a glance you can see key statistics regarding cancer subtypes and treatments. Reviewing surgical, systemic therapy, and radiotherapy treatment rates for lung cancer subgroups enables me to monitor whether my patients are receiving guideline concordant care, and if not, you can quickly investigate and act on variation immediately. Cancer Alliance Queensland have done a lot of calculations and built a lot of methodology into the back end so you can create advanced calculations with complex logic in seconds. You can still drill down easily to find more information by clicking on any of the bar graphs respectively. For example, if you wanted to see all the patients over 80, click on that bar and it'll show you their baseline statistics. By the way, any of these indicators are customizable and you can build your own to suit your MDT needs. For example, I want to better understand why certain patients had no treatment at this center. And again, if you click on that bar, it will show you their distribution of age group, their comorbidities, TNM stage at diagnosis, and also baseline ECOG performance status to see if this was appropriate for them to not have received treatment. You can also drill down further to other subgroups, for example, the use of chemotherapy in stage 2 patients. Here too you can click on specific years or time periods to see what information you need and want to review. For any subgroup you filter, again remember that you can easily download or export a list of patients, making audits infinitely easier, rather than relying on registries, which can sometimes and often be months behind. In conclusion, CoolDash is an integral and valuable tool for Queensland multidisciplinary teams. It facilitates patient outcome monitoring at a statewide level. The Cancer Alliance Queensland team supports clinicians and builds the tools and systems needed to analyse and report on the masses of statewide data. Finally, Cool forms part of the quality and safety ecosystem that facilitates research and collaboration to ultimately improve outcomes for Queensland patients. Thank you.